This morning we are joined by Dr. SenGupta with us in studio. Start off the program with the fear of the dentist. There's this myth that to go to the dentist is the worst thing ever.
Well, I wouldn't necessarily say so much of a myth. For many people, it is indeed a reality. I mean, going to the dentist is, for many, at least in their minds, a terrifying proposition as opposed to being a reality. I mean, what's in your mind is your reality. Many people have got that, and it's really, historically, in terms of, movies that are out there, it's always a sort of the running joke. Going to the dentist is such a terrible thing. I mean, the history of dentistry is sort of replete with horror stories. There is some basis in that, but things have come forward so much, particularly in the last few decades, that the dental practice is really not as horrific as it used to be. Since the advent of... it was actually a dentist that discovered anesthesia, and the first anesthesia was discovered by this dentist, Dr. Wells, who used ether. You would inhale this stuff, and you would be put into the sleep as such, and he performed a dental extraction under the use of ether. The thing about dentistry is that your teeth and the entire oral environment is so incredibly highly innervated. There's an enormous concentration of blood vessels and nerves within your head and neck. And every single tooth has at least a cluster of nerves going to it. And that's how it gets it can be extremely sensitive indeed. And so anything that happens with teeth, hot, cold, sweet, as we're all very familiar with, can be an issue. The causes of tooth decay and the causes of gum disease, which are really the only two diseases that dentists deal with in the mouth, is gum disease and dental decay. In short, is that you have your tooth structure, and the tooth structure gets damaged. How does it get damaged? It gets damaged by sugar. That represents more than 50% of what all dentists do. The other 50% is beyond the tooth has to sit within the gums and bone. So it's rather like a potted plant. If you wash the soil away, the plant falls over and it gets washed away. Even if the plant or the tree is perfectly healthy, no soil, it gets washed away. In the same way, if the teeth are not kept clean, the bacteria chomp away at the bone and the surrounding gums, and the teeth get loose. And that's called gum disease. So fundamentally, every issue that all of our listeners, whatever dental issues they have, is going to be originated from one of those two things, gum disease or dental decay. It's as simple as that. And when we began to understand, we as the dental community over the last century began to understand what were the causative factors, what actually caused gum disease and what caused tooth decay, then of course it was a game changer. Then we were able to say, well, if you do this and if you do that, then we can prevent this from happening in the first place. And if this does happen, well, we know how to deal with it. I would venture to say that all dentistry, yes, all dentistry can be done today totally painlessly. If I were to put the question out there, well, what is the greatest fear that you have from your dentist? And I would be pretty certain that we would get the following. Number one would certainly be the needle. Everyone's afraid of the needle. Number two would be the anticipation that I'm going to hurt you in some form of pain. Then beyond that, it's the one that I hear an awful lot of is the noise of the drill. When you go to the dentist, what we deal with typically on a daily basis is you have somebody, first and foremost, they're in pain. Secondly, they're scared. Thirdly, they really don't want to be there. Next emotion that comes into play is very often anger. Before I've even seen the patient, before you've even sat down, I've got a scared, angry person in pain sitting in the chair, and it's like, we're not off to a great start here. The magic to dentistry is not so much the skills for basic dentistry. I think the critical thing is, like with so many things, is you have to be able to connect with your dentist. We have to be able to see each other as a human being. We have to be able to recognize that you are in pain, you are afraid, you are not behaving as you normally do. You can put aside your social graces, and we can connect in a way that will put you at ease. That examination is critical. Dental pain, the most important thing we try and figure out is the characteristics of the pain. If you gather as much information logically and rationally as you possibly can, and that will assist the dentist greatly. The thing not to do is that very often people leave it so long, and they self-medicate. They self-medicate a lot. And here's a very important thing with regard to pills that I see people doing all the time. They take an aspirin, and they put the aspirin tablet by the side of their gum, and they leave it there, rather like cloves. Now, aspirin is a drug called salicylic acid. This stuff burns, and I mean literally burns. If I took a hot metal instrument and seared your gum, it would be the same effect of you leaving aspirin there one after another for a prolonged period of time. And so placing an aspirin by the side of the gum is not a good idea. If you're at a point of having to take medication for a toothache, see your dentist. See your dentist early. The longer you leave it, the more difficult it becomes to diagnose, the more difficult it becomes to treat, the more complicated it becomes to treat, and of course the more expensive it becomes to treat. Bear in mind, taking painkillers doesn't cure anything. Painkillers reduces the sensation of the problem you're having. So just filling yourself up with painkillers is reducing that sensation. It's not solving a problem.
Good morning, you're on the air.
I have a relative I've been visiting, an elder.
Mm-hmm.
And she has one or two teeth exposed. And she bit on something which had a bone in it. And one of the tooth got weak. And I'm trying to encourage her to take it out. And she said, no way, it will get back hard.
No.
Is that possible?
If the bone, the supporting tissue around the tooth is, and you say she's an elder, it's very likely she's got what we call periodontal disease. If a tooth has been dislodged as a result of a weakened foundation, what I do not recommend is to leave it, because the point is, if there's something simple that we could do to stabilize it and to encourage it, then we certainly would.
Doc, I have to ask this question, because part of that fear, you said it before, the needle.
Now, the thing about dentistry and needles, first and foremost, I mean, it's an imposing looking thing. I mean, a dental needle, the actual body of it needs to be long enough to reach the back of your mouth. If I had a tiny little tip the size of, say, my little pinky, I'd have to get my whole hand in your mouth to get to the back of your mouth if I'm working on the tooth at the back. So in other words, I need reach. So so that's the real reason for the size of the body. And of course, the body itself, it looks imposing, but that doesn't hurt. I openly state, it is absolutely possible for every dentist to give a painless injection. That is only possible if at first I can gain the cooperation of the patient. If I can have the patient give me their cooperation and trust. If I don't get that, I can't do it. Having said that, however, if there comes a situation where you have a lengthy procedure, or you just have somebody who is just so terrified that we have to resort to other methods in order to deliver the same anesthetic in the first place. And the way I do that, well, you're not necessarily in pain, you're just scared. Well, what do I do about anxiety? I can reduce the anxiety by anti-anxiety medication. And that will be by means of sedation. I can use I can give you certain types of tablets to make you sleepy or to make you drowsy. Many dentists use a dental gas, and that's a gas called nitrous oxide. It's a very, very safe thing to use. In fact, pregnant women use it. It's called Entonox. And women during labor are offered this in many countries, that they breathe this laughing gas whilst they're in labor. And I say that to demonstrate how safe it is considered throughout Europe and America. What I do on a routine basis is sedation dentistry. It's sleep dentistry. It is not general anesthesia. So it does not have the same risks and complications associated with total sleep dentistry, total anesthesia.
Okay.
The sedation means that you are responsive. So let's say I give you a couple of tablets now. You are completely relaxed, you're totally calm, your anxiety is gone. But if I poke you with my pencil, you will respond. You'll be like, ow, what's that? And if I say, well, Denise, you feeling okay? You'll be like, yeah. And,
but you're still feeling pain.
You're responsive.
Okay.
My issue here is your anxiety. And now, of course, so therefore I now have to give you the injections, the local anesthetic, to make your whole mouth numb. And now you don't care. And the beauty, of course, is when all is said and done, when those procedures are done, the drug also has an effect of giving you amnesia, so you don't even remember anything.
Sounds like fun to me.
The critical thing is regular visits early. If you take care of your mouth as you take care of your car, come every 6 months, have your teeth examined, have them checked, have them cleaned. If you do that, you will never, ever, for the vast majority of time, need any form of dental treatment. 95% of dental problems are self-inflicted, i.e. they're completely preventable. There's so much we can do in terms of preventing this problem happening to your children. And that's something that you must be very cognizant of. You must bear in mind that sugar causes decay. The other aspect of it is, if you keep your teeth clean and your gums are healthy, the foundation and the support around your teeth remains stable and strong. If your kid grows up with a low sugar diet and brushes their teeth twice a day, every day, they will never, for the vast majority, they will never ever have to have an invasive dental procedure done, apart from possibly wisdom teeth or braces, but that's another story for another session.
You keep saying it's not painful, but afterwards.
Okay, post-operative pain, that's a good topic. Post-operative pain means basically after a dental procedure, you can have some pain and discomfort from, depending on what the procedure is. Post-operative pain can be taken care of, and the vast majority of time, the reason for that is the way that we make dentistry painless even after the procedure, and in this particular case, the procedure in question is the extraction, is that we medicate you. We know that we're going to take a tooth out, so I already start you on pain medications before you come. When you come in to have the tooth taken out, we ensure that you have pain medication on board. We don't wait for the anesthetic to wear off before you take another pain tablet. And that same night and the night after, we ensure that you have the pain medication. So medication before, during, and after is one of the solutions to ensure pain-free extractions before, during, and after. Another important solution is that the dentist has to be very gentle. If you are aggressive and if you are rough, you're causing trauma. If you have to put your boots on as quickly as you possibly can and you don't bother undoing the laces and you force the shoes on, well, you're going to hurt your foot. If you don't undo the laces, you'll hurt your foot if you force your feet into the shoe. Same way, if I'm rushing and if I'm grabbing this tooth and I'm yanking it out and it's very aggressive, in spite of the fact that you will not feel it because you are anesthetized, it will result in more post-operative pain. So, gentle technique. A very, very important factor is smoking. Smoking is just so bad on so many levels. Honestly, if that stuff came out today, it would be the most illegal drug known. It is just so bad on so many levels. Smoking and tooth extractions. Smoking causes what's called vasoconstrictions. It causes the blood vessels to constrict, for the pipes to get small. We must have blood. Blood is the magic potion in our bodies. Blood heals everything. Blood fixes everything. And if we have smokers who are smoking on a regular basis, the blood vessels constrict, they get narrow, less blood gets to the healing site, less blood, less healing, more pain. It's called a dry socket.
We have a listener who wanted to get a question in. Good morning.
Right.
Yeah, good morning.
Good morning.
Yeah, I want to find out if you all have plan, like a dentistry plan. Okay, why I say that? Because normally every 6 months you said to clean, you have to clean the teeth. Mm-hmm. But the price at the time for every 6 months is like, sometimes it's too much for you. Mm-hmm. You understand? But if you have a plan, like you pay, like, I know some places, like in the States, you have a doctor thing that you pay every month, like a fee. So if anything happens, you can just go.
It sounds like you're talking about insurance.
Like towards the doctor. Yeah, well, you deal with the doctor. Right, you pay, like, because you know how much it costs a person for a year to clean the teeth. So within that year, the price that you're just telling to bring it up like a weekly thing would cover it for the whole year.
It's not a bad thing you're suggesting at all. There are various forms of dental plans available. I mean, many people that we treat here, they have insurance. They have dental insurance, and that's the insurance premium is deducted from your salary on a monthly basis. And when you go to the dentist, you're reimbursed very often in full, especially for a checkup and a cleaning. I mean, this is such well-recognized treatment. And by the way, a checkup and a cleaning, an X-ray, and basic dental treatment. This is pretty inexpensive, and I would state in Antigua, I would say that a checkup and a cleaning will vary across the board from about $150 to $250 for a checkup and a cleaning, and that will the lower end will be for kids, the upper end will be for adults, and I don't think I'm wrong by more than maybe $20 or $30 by most practices here. Now, the thing about it is this. Is that if you don't make that level of investment of, say, $300, $400, even $500 a year into your health, into your dental health, a problem that can potentially arise will result in a procedure. Now, as soon as you start talking procedures, we begin to talk double that.